Most people think heart attack happens suddenly. One day you're fine, the next you are in an ambulance. But that's not how it works. The truth is, your heart attack may have started 20 years ago or more, silently, without a single symptom. And the scary part? A normal scan can miss it completely. Stay with me because understanding this could save your life. Heart disease does not begin as an emergency, it begins as a tiny invisible process inside your arteries. Years, sometimes decades before you feel anything. Guess what might be happening inside the body even right now? Even if you feel completely healthy, the problem starts here. It starts with a small injury in the inner wall of your arteries. Think of it like a microscopic crack, tiny fat particles that enter through that crack. Your immune system notices that and sends in some fighters. But this fight creates inflammation. So over time, that inflammation builds up layer by layer into what we call a plaque. No chest pain, no shortness of breath, no warning signs, just quiet, slow buildup happening inside your arteries while your regular day is going on. That's why it's so scary. That's why so many people pass the regular checkups and still have a heart attack. Here's something your doctor might not have told you. Stay with me till the end and you'll know all the facts. Let me start with the calcium scan proper. A calcium scan is one of the most common heart tests. It looks for plaque that is hardened inside your arteries. And if the score is 0, most people think or most people hear, oh, you're fine. But here's the thing, calcium scan finds older, hardened plaque inside your arteries. But heart attack often comes from a different kind of plaque, soft, inflamed, angry plaque. The dangerous part is that this softer plaque may not show up on the heart scan at all. And if the soft plaque suddenly breaks out, a blood clot can form very quickly. That clot can block the blood flow to your heart, causing a heart attack. So, the biggest danger is not always the biggest blockage. And a normal scan does not always mean that your arteries are truly healthy. You gotta remember this. And let me take you to the next level now. For years, most conversation about heart disease focused on LDL cholesterol. But modern research is shifting towards something more important, apolipoprotein B. ApoB, and this is actually simpler than how it sounds. Let me tell you in a very simple way. Let's understand it by the traffic analogy. Think of your arteries like a highway, and the ApoB particles are the cars. It's not about how big the cars are, it's about how many are on the road. So more cars means more chances to crash into the artery wall. More crashes means more plaque build up over time. So now you understand why we need to measure this ApoB particles. So even if your LDL cholesterol looks normal, a high ApoB level could still mean that the plaque is building silently. That's why the shift of landscape of cholesterol treatment had changed. Two people with the same exact LDL cholesterol number can have very different heart attack rate. You gotta understand this. That's why apolipoprotein B is the new game changer in cholesterol management. So it's not just the LDL what actually matters the most. Modern heart disease prevention focus on several major drivers. Apolipoprotein B, the number of particles entering your artery walls. Blood pressure, high blood pressure damages your artery walls more than anything else. Smoking, that's trouble. It accelerates the plaque buildup more than anything else. Insulin resistance is strongly related to inflammation and fat buildup around your arteries. So you see that the traditional factors that we have been talking, hearing about have changed. Now we talk about the visceral fat, the deep belly fat you can't always see from the outside. That's so much important and getting attention these days. And yes, family history. Never underestimate your family history. Some people inherit a naturally higher baseline risk for heart disease than others. Genetics is so much important. And now the goal is not to wait and find the heart attack. The goal is to remove the conditions that allow it to develop in the first place. So the biggest shift happening in modern heart medicine is we don't want to wait for the disease anymore. We look earlier. We are aggressive in sending for labs earlier. We act earlier because heart disease is cumulative. The most powerful heart test is just not a scan or a simple blood test. It's what you do every single day. You got to make sure you lower your cholesterol levels, control your blood pressure, and improve your metabolic health, reduce inflammation. That is how you prevent a heart attack. Just not by a single pill. You got to prevent a heart attack before it ever begins. If this changed the way that you think about heart health, even a little than yesterday, send it to someone who thinks they're too young to worry about having heart attack, because heart health matters, and we really want to partner with you on your heart health, because the best time to protect your heart health is now, not when symptoms appear, not after you having a heart attack or you have scars on your heart. Subscribe to Healthy Info for more clear, science-backed health content. We got you.